Hello and welcome to the Pro Dental Podcast. Today we're joined by Dr. Tom Bereznicki, founder of the Dr. Tom Bereznicki Foundation. Tom, how are you doing today? And thank you for joining us.
Oh, I'm fine, thank you. Freshly back from a 10-day trip to Italy. Very refreshing. It was lovely to get away. As you probably know, I've had a period of ill health, so it's my first proper holiday in 18 months. So it was nice. And I went with a bunch of friends. So it was nice. Thank you. I'm very refreshed.
Fantastic. Well, you're looking very well for it as well.
Thank you.
I wanted to start things by, kind of for anybody unfamiliar, if you could just introduce yourself, give us a bit about your background, but also the foundation and how that came about, and provide a bit of an overview of what you do.
Okay. So, where does the name come from? My parents were Polish immigrants after the war. Pretty easy to understand now with the Ukrainian war, where a lot of Ukrainians have left the country that's been invaded by Russia. So my parents were the same after the First World War, and they ended up in Britain. So I was born in London, then educated in Glasgow at school, a bit in London, then Glasgow, and then I went to Edinburgh University. And Edinburgh University is quite interesting because 80% of the population had no teeth. So we were fantastic at extractions and making immediate dentures and full dentures. But it was a bit like glorified plumbing. And I read that wasn't how I envisaged dentistry as being. So as soon as I graduated, I moved down to London. And that's where I started my career.
And sort of how did you sort of get to today? Obviously, where you're running this foundation, a sort of charitable initiative, regarding sort of education for sort of, I guess, young up and coming dental professionals. Kind of how did you get here?
I think we had an incredibly good background in dentistry clinically, much more so than we do now at undergraduate level. For example, give you an example, our medical legal was nobody would have gone to the medical legal if I think it was Medical Defence Union of Scotland hadn't had a cheese and wine party afterwards. And the talk actually lasted all of half an hour. And the only thing I remember them saying is, you won't get sued unless you kill somebody, or struck off unless you kill somebody. You won't get sued because the definition at the time was what would be expected of the average dentist, and that you couldn't define. And the third one was really bizarre. They said, oh, now if you want to have an affair with one of your patients, wait till you finish the treatment, because under the NHS, when you finish the treatment, you cease to be a patient of the practice until they sign up again. I mean, that's the three things I can remember. It was a different era. And the good thing about the different era was we didn't have any fear. When I came down to London, I had my first house job at Guy's and then 2 house jobs at the Royal Dental. I was never afraid to do anything that I may get into trouble or may get sued. So, how do you learn? You can only learn by experience. You can't learn to take a tooth out in haptics. You've got to do it. And so, for example, in that house job I had in minor oral surgery, I was taking out 300 teeth a day. I mean, yeah, raised your eyebrows at that. Massive amounts of teeth, a lot of surgical aids. I mean, we just had way more experience. And so I didn't get on in the NHS. Well, certainly didn't get on in the academic world because I'm not really academic. And then I went into practice. It was a mixed NHS private practice, but I didn't like being told what materials I had to use, what I had to do. I just didn't enjoy it. So I wanted to set up my own practice. So having graduated in 1976, I set up my own private squat, and it was all private dentistry in Queensgate, not Queensway, Queensgate in London, right opposite, round the corner from the French Lycée. And I broke even within 6 months. But having been offered some West End partnerships where they had a commissionaire with war medals on the front door and everybody wore a suit and a tie, I wore chinos and a T-shirt. And I appealed to a different patient group.
Different audience, so to speak.
Yeah. So, and I stayed there really. I had it for 30 years. And then I had my first bout of ill health. I got bladder cancer, which was fine. I worked all the way through the treatment, chemotherapy, radiotherapy. But slowly it dawned on me that what would happen if it came back. So I moved myself and my patients to Andrew Darwood's practice, Darwood and Tanner, in Wimpole Street, and I sold the premises. And then once I didn't have to run a practice, it allowed me to take a day off and go and teach, which I did at King's in primary dental care unit. And that's really, I'd mentored a lot of young people and young dentists. Anybody that knew anybody that was a dentist would say to me, "Oh, can my niece, nephew, whoever come and watch you work?" So I was always open to teaching. Um, and then that was it. So that was me going into teaching. And then the students asked me to do some lectures out of hours in the evenings. So I put together a program. And the program was really based, I think, very cleverly, because I knew what they knew, but I also knew what they didn't know. But they didn't know what they didn't know. So it was quite a popular program. At times we had about 100 students there, depending on what the topic was. And then really, that's kind of where we've arrived at, where I've stopped working clinically and now devote my time to mentoring and setting up the charity.
That's quite a story. And going back to the 300 teeth a day, I was trying to do the maths in my head quickly then. So what's that, sort of 8,000 to 9,000, depending on how many days a year sort of works?
I'm good at maths, but yeah, I didn't. Well, it was there were 6 chairs. It was the days before you wore gloves, before HIV, and there were 6 chairs, and you'd go local, 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 extract, 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 check, check, check. The nurses would go out, and the next 6 would come in. And then in the afternoons, I must have been quite good at it because I actually got to supervise students on the general anesthetic clinic as well. And then I did quite a lot of minor oral surgery, wisdom teeth, mildhide, ridge reductions, roots, buried roots, whatever. So yes, it was it, and that's the difference really between today, but then, and I mentor a few dentists now, and one of them is on maternity leave at the moment. And she got asked to come into the practice to take out a deciduous E on a 9-year-old because nobody in the practice had the guts to do it. There's the difference in confidence, which I had, which doesn't seem to be there today.
It's interesting, isn't it? Because obviously, like, as much as we talk about, that shouldn't be the case, obviously, with a 9-year-old in particular. Obviously, if it needs to be done, it needs to be done. Since launching the foundation, what's been the most surprising thing that you've learned about the needs of kind of the early career dental professionals?
I think the biggest surprise was that I was right. It's one thing launching the charity with an idea. John Maloney of GC was very, very instrumental in helping me and guiding me through that process. But the proof of the pudding is in the eating. It's all well and good going, this is what I want to do. But then if nobody comes, you're a failure, even if the idea is good. The difficulty has been traction. And traction's been difficult because it's all social media led. No 25-year-old dentist is going to read the British Dental Journal, no disrespect. I mean, they're not likely to. So the usual ways of finding about conferences, which is the way that I did, which was letters or journals. Nowadays, it's all social media, and it's difficult to break in to get that critical mass where whoever's come on a course lets 10 people know it was worth it, and they let 10 people know. And so we're growing slowly, but maybe not as quickly as I'd like.
Okay, so I know in the past as well, you've also mentioned there being, kind of concern with, I think you described it as a disconnect between undergraduate curricula and and obviously contemporary clinical practice. And obviously you've sort of touched on that with, I think obviously sort of going back to the 9-year-old as an example. What are the specific skills or areas of knowledge that you feel are kind of almost sort of, I guess, dangerously lacking kind of in new graduates today?
Joined up thinking. It's still very department led. So you do prosthetics and prosthetics. At King's, when I was there, I was teaching the primary dental care unit. But even then, there were things you couldn't. That student couldn't look after somebody's orthodontics. That student, as at one point came in, wasn't allowed to do extractions anywhere other than the oral surgery unit. So if they needed to take teeth out for put an immediate denture in, they had to book an appointment in the oral surgery unit, take teeth out, and then come back into my clinic to be able to fit the denture. So it's not like being in practice. And so what is the disconnect? The disconnect is when you go into practice, you suddenly have a patient that comes in, haven't been to the dentist for 10 years, so you've got to do your examination, treatment planning, present the treatment plan, present the options, and then carry them out. Now, an early dentist isn't, if they take a tooth out, you would say, for example, right, as an immediate, you could have either a denture to replace the front tooth or an adhesive bridge. Then things need to heal, and then maybe you have a permanent adhesive bridge or you have an implant. But it's the confidence to be able to go through that sequential pathway and making the patients aware of their choices, because not everybody's bothered if they have a denture or not. Other people go, I'm over my dead body. Am I ever going to have a denture? Which kind of reminds me of a story where one of my patients once came in. They came in with their husband, and the husband wanted to come in. She went, no, you can't come in. The husband didn't know that she didn't have any upper teeth, and that she wore a denture. Yeah, you know, uh, you the point is it's experience how to handle all this. I had to go to the husband and kind of go, well, everything's fine, but she'd prefer not to have you there, and but don't worry, if there's an issue, we'll call you in. And I think that is a transition from university into practice, but that is dependent. Your transition is dependent on where you're based. So if you're in rural Scotland, your experience will be completely different to whether you're in central London, because here in central London, not many people are taking their teeth out. Maybe in rural Scotland, areas like Luton, Liverpool, it's a lot of extractions. There's a lot of caries. So your experience, even as in foundation training, is A, dependent where you are, and B, whether you have a trainer that takes an interest in you and helps you develop your career, or just goes, well, unless you have a major problem, get on with it. So that's why we set up the foundation aimed at young dentists, is to try and give them more confidence in what they're doing. I'd love to do a course on treatment planning, for example, but there's a limit to how much time we can spend and how much money is available for the activities that we're trying to run.
I know that one of the one of the courses that the foundation offers is fully funded training in composite layering, digital dentistry, and also injection molding techniques. Why did you choose those specific areas to kind of focus on? Obviously, I think obviously for your competitions as well that you run.
Well, there are two issues. We run the competitions because I can't just I don't think it's fair to, it's like tickets to a concert, log in, and the first 20 to go on a course. So we felt that at least having to have a pretty simple competition in that there's not much writing. You have to just present the before and after photos. And then we have an independent panel that judges. And then depending on which course we're doing, then the top 10, 20, whatever they may be, get the free places on the course. So that's how that bit works. The other thing is that we're because of social media, we're incredibly patients are coming in going, I want to look like this, I want to look like this. You only need to walk down the street in London to see how many ladies have lip fillers, butt lifts, okay? I mean, breast augmentation. This is all patient-led. You don't go to your GP who goes, you need to have breast enhancement. This is patient-led. Now, depending on where you've had your experience after university, well, it may be an area, maybe rural Scotland, where nobody's particularly bothered about a mouth full of white veneers. But if you break a tooth, if you're working on a farm in that, patients would still expect you to provide a restoration that you can't see, not something that just looks like a lump of composite that's the wrong color. So we've tried to focus on things that are pertinent to virtually every young dentist. The digital course I'd sooner deal with separately because that's not quite the same. But injection molding for wear cases now, it used to be full mouth crowns. Now it's all done with injection molding. If you graduated 2 years ago, a year ago, it's unlikely that you'll have carried that out at university. So where are you going to get the training? Not everybody wants to or can afford a 1-year diploma course. Some of the courses, if I think that young dentists earn about £40,000 a year in their first year, you can't afford to spend £1,500 on a weekend. I mean, it's just too much money. So, okay, as I say, I'd love to reach out to everybody and just run all these courses, but we can't. We just don't have the funds to be able to do that.
So obviously, one of your winners, Jarmima Udin, recently, she won place on the course, and she mentioned that these opportunities gave her the confidence to apply for private practice roles afterwards, which she didn't have before. Do you see the foundation's role also as, kind of, it's not just being clinical training, but I guess also providing that way to sort of boost that professional confidence of the young dentist? I mean, I feel like you kind of answered this a little bit earlier, actually, but yeah, do you see
I've got a
that?
different. I do have a different example I had in my head. Do you remember when you were at school in the gym, there was a thing called a beam that you had to walk across?
Yeah.
Do you remember? Yeah. Okay. Well, if you put the beam 6 inches off the ground and said to everybody, walk across it, they'd walk across it. The chance of them falling off is zero. Raise it to 1 foot. Most of them will walk across, maybe a bit wobbly, but they know that if they get too wobbly, they can just jump off. Now raise it to 3 feet. Now people are going, there's no safety net. No, I'm not confident with that. Raise it to 6 feet, and then only a few people will have the confidence to go at 6 feet without a safety net. And dentistry is confidence. I mean, when you've got the high-speed drill going, water everywhere, the suction tips thing, you have to have the confidence that you're doing the right thing, and you can't always see what you're doing. And you only gain experience by repetition. The world's best gymnasts they might have a natural instinct for it and a natural ability, but the rest of it just comes with endless repetition. And something like the composite build-up course, I mean, I've been on it with them for 2 days. They do composite, they understand layering, surface texture, color selection. And so Jemima, when she went on it, to me, it just gave her the confidence that she has the ability to be able to carry something out in practice, to be able to say to the patient, yes, I'll do this for you, no problem. And it's not a case of whether they work. We're not training them to be, or we're not teaching them to be either NHS or private. It's teaching them to have confidence for wherever they work, to work to the highest standard that they're capable of. Does that answer your question?
It does, and I was just wondering, in terms of kind of that confidence as well. Before, because obviously you mentioned kind of the repetitions. Do you think it's kind of a case of if you don't have enough practice in something, you tend to overthink it as well, and that kind of leads to your confidence dipping?
Well, it does. I mean, it comes back to the beam. the moment somebody sees that 6 foot up, they're questioning themselves. So the confidence building, I don't think that undergraduates come out with anywhere near the clinical experience that I had. There are various reasons for that. As I said to you, medical legal was half an hour. They spend hours on it now. I mean, it still baffles me why in the curriculum they're doing pathology first, second, and fourth year to be able to recognize something under a microscope. I mean, nobody's going to graduate and buy a microscope and do their own pathology. In fact, there are pathways now. Why? Because if you go and dig a scalpel to do a biopsy and it's malignant, you're actually spreading the malignancy. So really, what does it matter in terms of histology? You just need to know that's not normal. You need to know what it is, and there's a pathway to refer them. So they're spending a lot of time doing things that I don't actually think are that important, but they don't spend enough time developing clinical skills and thinking ability, treatment planning ability. I think there's just too many other. Something has to go. If you remember marbles, if you had a box of marbles, if you had one marble too many, you pressed it in, another one would come out.
Yeah.
So if you're adding things into the curriculum, something's got to come out. Occlusion is the basis of the success of any restoration. It doesn't matter which restoration, occlusion has to be correct. And that's getting squeezed out and out and out and out. And yet it's the foundation stone of all your dentistry. Why? To make space for other things. But they're not taking, in my opinion, the right things out.
I mean, you mentioned sort of workflows a moment ago as well, and one of your awards focuses on digital workflows. Do you feel that a young dentist, kind of today, can even achieve sort of clinical excellence, so to speak, without fully embracing digital technology, or kind of is that now a prerequisite?
I have a favorite phrase. I think it's mine. I don't think I heard it anywhere else, which is I entered a profession, I'm leaving an industry. Now, I'm not criticizing it as an industry, okay? Because the industry is inventing things as it goes along. And if it didn't, we wouldn't have our light cured composites. I mean, I'm not criticizing it, but industry tends to lead the way. I know that numerous colleges for dental technicians have shut down because there isn't the demand. Why? Because if you go into a digital practice, they teach you to design things on computer, which is something young people are very good at, but they don't really understand. They may not necessarily understand anything to do with teeth. They just carry out whatever it is they're supposed to carry out digitally. Now, the problem is that if you're not doing digital in dental school, now it depends on which school you're at as to how much experience you have, but even scanning, you can't just kind of waft the scanner around. There is a sequence that you have to do it in, otherwise there's distortion. And I think that we're going to less and less conventional technicians because they're not training, because they're being trained in digital. So what do I think of the pathway? I think the pathway is that's the way it's going. I know any of the famous speakers you listen to on, and if you go on a course like Pascal Magne for a day course, well, all the famous dentists, if they're talking about veneers, they just go, if you can find anybody to do feldspathic veneers, that's what you put in because they're the most successful, they're the most long lasting. Now, there aren't very many of these technicians around, and if they are around, they're charging a fortune because there aren't many around. So the shift to digital is a shift, whether you like it or not. You can't put your finger in a dam and expect to stop the flooding. It's just not going to happen. But the issue with that move is I don't think that young dentists get enough teaching and training in digital techniques. Be it scanning. I mean, that's the first one. If they all had 2 or 3 days scanning, they'd get quite good at it supervised. Now, depending on where they end up in their foundation training, they may go into an all digital practice and go, like, what am I supposed to do? I haven't got a clue. So digital dentistry is here to stay, whether we like it or not. And analog will be gone, other than a handful of technicians that will be left. But the biggest issue is that they don't understand the science. You cannot write down, just make me an Emax crown. Because Emax pressed, Emax lithium disilicate milled, or zirconia milled. They don't understand any of that because they're not taught it. So, what do I think of it? I think it's inevitable, but I don't think there's enough training, which is why we do the course in digital dentistry. And certainly the two so far that we've run, everybody leaves going, it's just fantastic. I have so much more confidence now when it comes to doing something digitally.
It's interesting, isn't it? It feels like there's almost like a kind of sort of a balance to be struck between kind of that digital knowledge, but also then, I guess I don't know what's the word I'm looking for. Kind of the sort of almost like foundational knowledge you perhaps need that I guess the digital side sort of taking away from. But I guess ensuring there's still that human knowledge there. Does that make sense? It made sense in my
Yeah,
head.
it does, because digital, I mean, you're much younger than I am. I mean, I don't mind making an idiot of myself. I'll tell you a story about a fax. Okay, so faxes were suddenly invented, and I used to like going on driving holidays, and to book a hotel, you had to send a check by mail. Okay, and that was the way it was done. So in France, you had to send all these various things off. Anyway, I got fed up with this, so I bought a fax machine over the weekend, left it on for my staff to connect it all up. And they said, look, I bought this because I've got these 6 hotels to confirm. Can you fax these 6 letters? And they went, hey, yeah, sure. Anyway, they got it up and running. It's up and running now. And I walked through to the office and I said, but have you sent them yet? And they went, no, I've just got something else to do, but we'll send them in a minute. And I came back after an hour and I said, oh, you still haven't sent them? And they went, yes, we have. And I said, we can't if they're still here.
Oh,
Right, it hadn't occurred to me. I'd never thought of how does this go, or how does it work. And I use that example because I think that is what the move from analog to suddenly finding digital dentistry is, that massive thought process change. You can't wave a magic wand or hypnotize somebody to understand it. It's a process. So that's why I think digital dentistry, what we're trying to do with digital dentistry, it is to explain the bits and pieces behind it, the materials, the material choices, what is and what is not possible. When zirconia first came out in full arch bridge work, they did it in solid zirconia and they all fractured. Now you have to have a tight milled titanium base and crowns on top of it. So all of it is a process, and it's a learning process for the industry, and it's a learning process for the dentists. But as I say, the curriculum's full. What are you going to take out?
that's the thing. You can't keep
Yeah.
everybody kind of in training forever. And
No, yeah.
I mean, to move along a little bit, obviously you're launching a new clinical skills award for dental therapists and hygienists as well, which sort of caught our eye. Kind of how important is the team approach to achieving clinical excellence? Obviously, so obviously this is looking more, I guess, towards sort of skill mix and that side of things.
Well, I can only speak from my experience of the young dentists that I know or I knew at undergraduate level. Most of them were like perio yuck, you know. They just didn't want to sit there scaling teeth. Well, that's what hygienists are for. Therapists, I think, are extremely useful in those areas which are very high caries rate in children that need to have something done. It doesn't have to be aesthetic. It just needs to be sound. So I think that almost young dentists need to be taught to work with hygienists and therapists in dental school, but they don't. They refer them, but they don't work with the actual hygienists and therapists. But I believe that the hygienists and therapists are an integral part of the dental team, because unless you really, really like scaling, polishing your own patients, you like doing your own periodontal surgery, you like doing it all yourself, you can't not work with the hygienist. And the hygienists and therapists have to remember that they work under the direction of the dentist. So they don't work of their own accord. It's part of a team looking after a patient. I mean, to the best of my knowledge, you might confirm this, but you can't have a hygienist opening up a dental hygiene shop in the high street. It has to be within the confines of a dental surgery, which means teamwork. And so I think very often hygienist therapists are kind of not included in very much in the dental world. So I felt that including them in the foundation would be a nice move.
No, absolutely. Obviously, there's obviously, kind of, I guess, kind of more, able to start certain courses of treatment on their own, kind of now with, sort of via direct access and things like that. But I think there's still probably, quite a way to go in terms of, really maximising kind of the use of the skill set of both dental hygienists and therapists.
Yeah, it's teamwork. I mean,
Yeah,
you take dentists, I don't know, 60 years ago, they didn't have a nurse, a lot of them. I couldn't work without 3 nurses because somebody always had to pop to the loo, somebody had to do something, somebody was off sick. I needed a minimum of 2 to be able to work efficiently, effectively, and safely. And I think that it's the same thing. We're still, unfortunately, too far away from most dentists seeing hygiene therapists as being part of the dental team. And that by part, I mean popping in to see how the patient's getting on 6 months later. Not they don't necessarily need a dental checkup, but just to see how they're getting on, say hi.
no, absolutely. Yes, it's something we've covered quite sort of extensively over the last couple of years as well. And there's certainly more that can be done. And I think some sort of practice owners who perhaps need to sort of explore that a little bit more and realise actually they could make more money from making better use of other dental professionals other than sort of just the dentists.
Yeah. I mean, you use the word money. I don't find it a dirty word. I think a lot of people find it dirty. But I think the dental profession itself, practice owners need to appreciate that it isn't, the practice is not the little tiny bits and pieces and the separate dentists. It's teamwork. It's the moment the patient walks in the door that hopefully you've got a regular front desk who go, "Oh, hi, Mrs. Smith, how are you? Did you enjoy your holiday?" That's what makes a practice. And then, there's integrated treatment. Not that every time the patient walks in, they're seeing a different dentist and there's no joined up thinking. And I think we have a long way to go yet before we have a dental practice, which I regard as being a true dental practice. I mean, at the private sector, there's a lot, as you well know. There's the big practices with the periodontist, the implantologist, the endodontist. They have a whole team, but not all practices are that big, and not all practices are capable of having that number of specialists within the practice.
One thing I wanted to ask actually as well was, kind of for the more kind of senior dentists and practice owners perhaps listening who have kind of achieved their success. What would you say to them to encourage them to kind of give back more to the next generation, kind of similar to a way that you have?
We're desperate. I think the profession of dentistry is desperate for older dentists who have that knowledge, who are keen, who still really enjoy dentistry, is to take a few people under their wing. I've been talking to the College of General Dentistry about maybe starting up a mentoring scheme. The mentoring is kind of fine, but you don't really want to get into the stage of knowing out the boyfriend, girlfriend problems, this, that, and the other. It's just getting young dentists to come in and watch them work, which is what I used to do. And the thing that surprised me is when I'm not going to bore you with the story, but I wanted to find out what the numerous dentists that come through my practice from King's thought they would, what they'd learnt most. And my impression would be it was how I worked with my nurse, or how I used retraction cord, and all of them said the same thing. It was the way that you speak to your patients. They all said, like, nobody ever said no to you. You just presented things in a way, and that's what they found most useful. And that's the knowledge and wisdom that older dentists have, that you may not want to mentor somebody in how to place an implant, but having somebody in your practice and just sitting in and watching how you work and how you interact with patients. Because pretty soon, the older ones are going to die off or retire, and the new ones are going to start coming in without that experience and mentorship. So we desperately need something. And I know there are a lot of dentists that are keen to help out. If you take our occlusion course, which this year, the all-day occlusion course is, I think, 24th of October, we've got Paul Tipton, Ken Harris, Tiff Qureshi, Corey Farron, I'm missing Shiraz Khan. They're all giving up their time for nothing because they believe in giving something back. It's an introduction to occlusion. You're not going to walk out of there knowing everything, but it'll give you a solid foundation to look at your patient in a different way. And I know, I belong to the London Dental Fellowship. I have numerous dentists coming up to me and saying, look, if you need any help in any specific direction, quite happy to give up my time. So there are a lot of dentists out there who would help, but how do you set all this up? We can't do it. We don't have, the moment I start employing 4, 5, 6 people, the money's gone. I mean, it's my money. We're not, it's the foundation's money, but it's my money. We have to be careful what the outlay is, otherwise we'll go belly up after 5 years. So there's only so much we can do, and salaries, of course, start being the big thing that eat into the charity money. So we're limited, which is why I'm trying hard with the College of Dentistry to try and get this form of mentorship on the go, where a dentist, for example, in Yorkshire, somewhere in a village or a small town, just goes, yeah, I'm quite happy to have somebody sit in if they're young. But it takes a lot of organization.
That's the thing, that kind of set up as you mentioned, as where you're going to, sort of, young dentists are going to learn the soft skills that you don't necessarily sort of learn, isn't it? Like you say, sort of communicating with patients and kind of how to, I guess, achieve that sort of course. Treatment, treatment acceptance. I mean, just to finish off. Sorry.
Sorry, can I just say one thing? And I'm not having a go at the institutions or anything, because I've been a young graduate and I've worked on a clinic with Professor X or Professor Y. You don't learn soft skills because these patients have been referred in for a specific problem and they know they have to have it done. So soft skills don't come into it. They're trying to get through and organize things. They're not going, how are you? Where do you come from? What do you do? So you don't learn soft skills necessarily at dental school. You might learn them from the dentists outside who are supervising the clinics, but not all of them necessarily have the time or the inclination to pass on those soft skills.
Just to kind of finish off, I wanted to ask you as well, if you could go back in time and give one piece of advice to your younger self on your first day in practice, knowing what you do now, what would that piece of advice be?
The chances are that you'll know more than you think you know, and you mustn't feel inhibited to become a hermit and be frightened to step outside the box and do something for the first time. Because if you never do it, you're never going to get better. So you have to have confidence in yourself. I mean, that you really, really need. You know, remember, like, do you remember your driving test?
Yep.
Do you remember,
Yeah,
right?
very
Right.
well.
So you have lessons. You have somebody sitting next to you. You have somebody sitting next to you. You pass your test. The first time you get into the car to drive on your own, you're petrified. Okay, there's nobody there. And so, what is the advice to young people? You know it. So don't be afraid to use it. Don't be afraid to go on courses and build on that knowledge that you have. But even if you do one of our courses, you've still got to do it on a patient. It's all well and good doing it on a phantom head, but you've got to be able to go out and do it. And so the answer is, have confidence and faith in yourself. It comes back to that 6 foot off the ground. If you think you're going to fall off, you will fall off. If you think you're going to make a mistake in dentistry, you probably will. If you don't think you're going to make one, it's unlikely. And I think that's it. You probably know more than you think you know. You just need that confidence.
And sort of accepting that failure is a part of life as well. That's sort of almost inevitable.
Well, it's a learning process.
It is.
I doubt if there's anybody that's driven a car for however many years without some little minor blip somewhere. You've scraped the car next door, or you've bumped it and the alarm goes off on the car. I mean, none of us are faultless, but as you gain experience, you get better at it. You get more confident. You make less mistakes. Less mistakes you make, the more confident you get. So you get into a positive kind of vicious circle, but it's positive. And you've always got to try something for the first time. You have to.
Absolutely. Brilliant. Well, Tom, I'm conscious that you've given up so much of your time this morning, and I know you've got to head off shortly. So just to wrap things up, is there anywhere kind of anybody listening or watching wants to find out more? Anywhere they can look you up?
Well, I have to be careful to give my private email away because I could end up with 20,000 emails, which I just can't do. We have our website. I think you've got the details of our website. If not, Claire will be able to give them to you.
Yeah, we can include that on the episode description. But
Yeah.
no, thank you so much, Tom. I really appreciate everything. For you joining us today and giving up the time. But hopefully we'll speak again soon.
Yeah, and I'm very grateful for you to give me the opportunity to promote and explain what we're trying to do with the charity.
No, you're very welcome, and it's been amazing to kind of see and learn about what is the foundation does. So, thank you for all you're doing to give back.
Thanks very much. Thank you. Take care. Bye.